Dr. Crystal Maxwell. Thank you for joining me as you learn how you can help fight heart disease. Heart disease affects the lives of many Americans and makes a major impact on the day-to-day activities of many individuals and families. According to the CDC, a staggering 610,000 people die of heart disease every year. For both men and women, heart disease is the leading cause of death. The most common type of heart disease is coronary heart disease. Coronary refers to the arteries that surround the heart and provide blood to it. The lack of blood flow or ischemia is what causes a heart attack. Over 370,000 people die of a heart attack every year. In order to fight against heart disease, there are several important things for you to know. What are the symptoms? How do you treat it? And how do you decrease your risk of developing it? Let's start with the symptoms. Symptoms someone may have of a heart attack include chest pain, feeling a fast heartbeat, feeling short of breath, indigestion, nausea, sweating, or feeling lightheaded. Some people do not experience symptoms at all. For those that do experience symptoms, it is critical to seek emergency care immediately in order to increase the chance of surviving. Prolonged lack of blood flow to the heart causes the muscles to die. Death of the heart muscle weakens the heart, which can lead to death of the person or decreases the person's ability to normally do his or her daily activities. Don't delay going to the emergency room if you or someone you know is experiencing these symptoms. You are helping to improve that person's chance of surviving and getting back to a normal life afterwards. Coronary heart disease can be diagnosed by an EKG, various types of stress tests, or by a heart catheterization. Once diagnosed, doctors may place a stent or perform a bypass surgery to restore blood flow. Medications are also used to treat heart disease, such as statins, which help to lower the cholesterol in the blood thinners that help to prevent new clots or break up clots that still may be present, beta blockers that help to slow how fast the heart is beating and to also lower blood pressure, and calcium channel blockers, which help the blood vessels to relax to improve blood flow. Medications is where the ball drops in your court in order to help improve your long-term outcome. If you are experiencing symptoms, it is important for you to let your doctor know immediately that you're having problems taking your medications so that an adjustment can be made. Don't wait until your scheduled visit to let your doctor know. Your doctor wants to know this now so that you can tolerate the medicines better and help you get back to your normal, healthy, active life. Treatment of coronary heart disease also includes several key elements of how you decrease the risk of coronary heart disease or a second event from occurring. It's important to take a serious look at both what you're eating and what you're not eating. Diets that are high in saturated fats, trans fats, and cholesterol have been linked to increased risk of heart disease. Also, diets with high sodium or salt increases the blood pressure. Prediabetes and diabetes also increase the risk of heart disease. It's important for you to read the food labels and begin recording what you're eating in terms of trans fat, saturated fat, and carbohydrates. Did you know that a 20-ounce Coke has 65 grams of carbs? That's 13 teaspoons of sugar. You don't know what you're eating or drinking if you're not reading the food labels. Be sure that you're also looking at what you're not eating. It's important for you to have green leafy vegetables, beans, fruit, and water as a part of your daily diet. Get regular physical activity. Quit smoking. Decrease the amount of alcohol that you're drinking. These are also essential lifestyle changes for both treating and decreasing your risk of heart disease. You've got to treat your body right. You've only got one body. Heart disease affects the lives of many people that we know and love, and maybe even ourselves. Some people may experience symptoms such as chest pain or indigestion, but some people may not have symptoms at all. If you do experience symptoms, it is important for you to seek emergency care immediately to improve your chance of surviving. Doctors may perform procedures or may treat you with medications only. In order to improve your long-term outcome, it's important for you to take your medications every day and make appropriate lifestyle changes. Let's start today with picking one change that you can make to help treat your body right.